Well, welcome everyone. My name is Misam Borman, and I am the Clinical Placement Coordinator here at WSU Graduate Programs in Nursing. This is our agenda for our Lunch and Learn. So we're going to just do a quick overview of the 3 NP programs. We'll have some information shared by our admissions person, Sammy, on the admissions process. And then we want to make sure we allow some time at the end for some questions that you may have. Like I mentioned, my name is Misam Borman, so I'm the Clinical Placement Coordinator. And then on the call today with us, we have our co-program coordinator for our Psych program, Dr. Voss. Sammy Eckerson is our Recruitment Admissions Advisor. Patty is our Office Administrative Assistant. And then Amy Harder is our other co-program coordinator for our Psych NP program. And then Sandy Heron, our Nursing Department Chair, is also on this virtual call. And then Kim Langer is our Acute Care NP Program Coordinator. And then Mika Valen is our FNP Program Coordinator. So those are all the different individuals that are on the call with us. With that said, I'm going to go ahead and turn it over to our FNP Program Coordinator, Dr. Valen, who is going to talk about our NP programs.
Great. Welcome, everyone. I'm glad that you're able to join us. This will just be a few slides. It's a very high-level overview of the programs that we have. And then, so if you have questions as we go through, we have time for that as well. So the 3 NP programs that we have, the first one, AGACNP, is Adult Gerontology Acute Care Nurse Practitioner. So that is for people who would primarily want to take care of patients who are acutely ill. So often that would be in an acute care setting like the hospital or outpatient with critically ill patients. Compared to the FNP, we also have that program, and that's mostly if you wish to care for primary care patients. So that often is outpatient, but the lines overlap as well. And then we also have a Psych mental health NP program. There are 2 main pathways for becoming a nurse practitioner through Winona State. We have a graduate certificate program and then also the Doctor of Nursing Practice program. So here are the program outcomes for graduate certificate students. So graduate certificate students would be students who already have a master's degree in nursing and want to become a nurse practitioner, whether family nurse practitioner, acute care, or psych mental health. And so these are the program outcomes. Next slide has the DNP program outcomes. So these would be for students who are coming in who do not have a different master's degree in nursing and are going from the baccalaureate to the DNP. And then also, these are the outcomes for all of our programs, but they would apply as the NP role as well. So here's a little bit more description. I started talking about this, that AGACNP, the acute care. Students are prepared to provide and manage healthcare of the acutely ill and critically or chronically ill patient. And it is a wide range of settings. A lot of times we think mostly of the hospitalist and the ICU and those kind of things, but there are wherever those critically ill patients are found, which is becoming more and more in the outpatient setting, in their home, that would be an appropriate role for this certification. And the family nurse practitioner is primarily trained to take care of patients in a primary care setting. So acute care management, generally as an outpatient, chronic disease management, health promotion, pretty much anything you'd see in that family practice arena, internal medicine, peds, women's health. And then the psychiatric mental health nurse practitioner is trained specifically to provide behavioral and mental health care across the lifespan. So really 3, I feel like, very exciting programs. So to be considered for the graduate certificate program, you would need to have graduated from a nationally accredited graduate program in nursing, and then have had in that program a few courses: advanced pathophysiology, advanced health assessment, and advanced health promotion, and then also advanced pharmacology. If you don't have those, we can we also have those courses, and so can work with you on getting those done. But if you look at this last layer of credits there for each of the roles, if you didn't have any of those prerequisite courses, those would be in addition to this number of credits. And so then that was for the graduate certificate. This is for the baccalaureate to the DNP. In all of the different roles, they're very, very similar in credits. And in that, there would be 12 credits of specific role clinical, and every credit is 60 hours. And then also you would have 6 to 9 credits of DNP scholarship credit. And then the one other option is for that person who has a master's degree in nursing who wants both to get the academic degree of the DNP and also be qualified to be certified as a nurse practitioner. So then there are a couple of additional prerequisites, having statistics, a course in nursing information management and decision making, and an organizational systems leadership class. Many students do have these in their previous masters, but again, we would work with each student individually on those prerequisite courses. And so then the credits vary a little bit more here because of what certain courses have to be in each of these, but you would get the nurse practitioner and be qualified to take the certification exam, as well as also completing your DNP educational degree. This is kind of a fun slide because it talks about the clinical rotations, which is, I think are one thing that really make all of this come alive and really get to be practicing and learning about your NP role. So for the acute care NP students, your clinical practicums would be with another nurse practitioner, with a physician, with the PA, and be in those acute care settings. You would have set rotations through multiple specialties to attain those clinical hours. If you were a graduate certificate, the number of hours may vary. Some people are you may be returning and you already have your FNP certification and you wish to add that acute care certification. So then you probably would be doing less hours than the 720 rule hours. Similar to that, if you were an acute care NP and wanted also to obtain your family NP, we would look at each of those and complete a gap analysis. Family nurse practitioners complete their clinical practicum with, again, nurse practitioners, PAs, physicians, and emphasize in primary health care. And psych mental health do have a little bit more strict guidelines on clinical preceptors. They would spend at least 50% of their time with a psych mental health NP, and then the rest with PAs and MDs who are providing psychiatric care. All right, I think I turn it over to Sammy now.
Yes, thank you, everyone. So I am here to provide the overall admissions process. There are 3 different pathways. So one is the international student application, and we will be going over that. The students will work with the international office and apply to WSU Graduate Studies, and they will work with the international student application before they apply to nursing CAS. There's also a pathway for the WSU RN to BSN graduate nursing pathway. This pathway is only for our WSU RN to BSN students. So if this is a pathway that students who are currently in our nursing program at WSU would like to choose, I would recommend that they go speak to their nursing advisor, and we can talk about this graduate pathway for them, and we can kind of work that out. And this is a really good option for them, but I would have them go speak to their advisor. We also have our general application for our general applicants, and we would just have you apply on the Graduate Studies website. And first we have you apply to WSU Graduate Studies, and then you apply to the Graduate Nursing CAS, or the Nursing CAS, and that opens in August for a fall 2021 start. Here's kind of a steps to apply. So step one, we want you to complete your graduate online application, and that is located at winona.edu/grad-studies, and that is our Winona State online application. Then you pay your $20 and request all your official transcripts to go to Winona State. If you would like to save $20, you can apply at the end of June, and we have a free application fee. Otherwise, it is $20 in official transcripts that go to Graduate Studies. Then your final step is to apply to Nursing CAS, and for Nursing CAS, they need all of your unofficial transcripts. So that is where you would need to also have your unofficial transcripts to provide to the graduate nursing program. So when you are accepted into Winona State University Graduate Studies, you also have the opportunity to take some classes in the graduate programs in nursing before or while you are applying to the Nursing CAS, so that if you're not really ready to start right away, you can kind of take up to 12 credits of those courses. So while you're doing that, you can take graduate special courses, is what they're kind of being called. So you take these courses and then they transfer into these courses, and they'll be counted and transfer in. So you can review these courses on the website, and if you are interested in this option, and you can enroll as the student and take these courses, and we can talk more about that too.
Thanks so much, Sammy. I'm going to actually ask Amy Harder, our program coordinator for our Psych program, to kind of cover some of those frequently asked questions we get from our students.
So some of the frequently asked questions that applicants typically have are, how are the applications scored? And so what we look at is a variety of things to make sure that people that are entering into our program are very well-rounded. And so that would include grade point average, professional experiences, certifications, scholarly publications, any professional awards, and then reference ratings. And so, like I said, it's really important to look at all the different areas of somebody's life and make sure that we're admitting candidates that are very well-rounded, because it's going to help them in the program. Other things is what would improve my chances of being accepted into one of the NP programs. In the Psych Mental Health NP program, one of the things that we have recommended, and I think is really important, is to know the role that you're going into. And so we often recommend that applicants be able to shadow a prospective or NP or anybody in a role that you would consider or where you want to be after graduating. And this is important because, if you're going into school, you need to know what you're going for, which is helpful. And so that's something that we look at. Other things that are really important is, once you've had the application, you've scored high, is we do offer people an interview, and making sure that you're preparing for the interview, because we do score interviews and take that into an account when somebody is applying and being accepted in each one of our NP programs. And so that would be for across the board, everybody is interviewed. Other questions is, can I work while being a student in one of the NP programs? Now, a lot of people do work, and typically they'll work part-time throughout the program. If you do a 4-year plan of study, the first 3 years would include core courses, and courses to prepare you for the NP role. And then typically the last year is more of those clinical years. And so you're doing more of the rotations, which takes quite a bit more time. And as you can see, 1 credit of clinicals equals 60 hours in a semester. And typically you will see 3 to 4 credits for clinicals, meaning you can go up to about 240 hours a semester, which is equivalent to 2 to 3 days per week you're doing your clinical rotation. And so keeping that in mind and looking ahead is really important to make sure that you're devoting enough time for your work and for schooling. And this just helps give you an idea of how much time you should be setting aside and what you should be considering when thinking about entering into a program such as ours. Other things to think about is, it takes 4 to 5 hours outside of the classroom per didactic credit. And so thinking above and beyond the clinical hours, if you have additional didactic courses that you're doing along with clinicals, that should be about 4 to 5 hours per week per credit. And so it's devoting a lot of time, and it's looking at how do you create that good balance for yourself. So looking ahead. Other additional questions or helpful tips is, can I transfer any credits from another education institution? And so I know we had kind of addressed that a little before, is Mika had mentioned about, if you do have credits, that we would end up doing a gap analysis, which evaluates what meets criteria for our classes. And sometimes people can transfer in up to a certain amount of credits. And so that's something that, don't be discouraged, to make sure that we have that additional information and we're able to do a gap analysis so we can place you into a spot that you should be. Other things, does WSU take care of clinical placements, or is the student responsible? Well, we are very lucky to be able to have a clinical placement coordinator, Dr. Misan Borman. And it's really nice because she works very closely with each of the organizations and helps with placement. Not all, advanced programs do this, and sometimes you have to find your own clinical site, which can be very challenging and very stressful. I can think about years back when I first started, and when I was in school, I had to do that, and it was extremely stressful, and I got really lucky finding good placements, but that's something that it's just luck of the draw. And with our program, we really do a good job focusing on finding placements that suit each of the students' needs. And so our clinical coordinator helps out with that. And lastly, can you do the NP program all online, or how much can be done online? So each of the programs, there are some face-to-face hours that need to be done. Otherwise, a good portion of our courses are online, and it's different with each of the programs, as you can see here. I can give you an example of our NP program for psych mental health. A lot of the didactic courses from the BSN to DNP in the beginning are face-to-face, and some of them can be done online. And then when you get into more of the clinical piece, most of them are online. And so looking ahead and looking at what program you're thinking about and what are the opportunities for face-to-face or otherwise kind of a hybrid or a synchronous class. And synchronous classes are online classes. Sometimes people can get confused with that word and do not know what that means, but that means that there's online portions for class time. And lastly, going through things, is what is the cost of the program. So the graduate nursing tuition rates, you could just click this link here and it shows for 2020 and 2021 academic year. And it is slightly different for some of the programs. So I encourage everybody to look and see what the tuition rates are so you're well aware before applying to the program. Do you charge out-of-state tuition? No, all students pay the same rate, which is wonderful. And so, we do have people from out of state that do apply to our program. And so that's one of the benefits that we do have. And then lastly, that kind of ends kind of just the information that we have found to be most important to provide. But I'm going to open it up to prospective students and see what questions you might have for us as faculty.
Well, I have a question.
Yes, go ahead.
So I was wondering, is there a cap in like the amount of students you guys can take? I mean, with the COVID and everything, I'm sure everybody's probably gonna have their applications pushed a little back, or just, assuming everybody puts in their applications on the nursing thingy by August 15th to be considered for fall like 2021. Is there students that have pre-applied to that are waiting to get into those programs at that time? And is there a set specific number of students that can be allowed to be in there? How does that go?
Mm-hmm. Those are some great questions. I think maybe Dr. Langer, we'll start with you as the acute care. Do you want to speak to that, and then we'll go through with the FNP and then our Psych program coordinators?
Misa, this is Kim, just so I understood the question. She's wondering about applications for this fall.
Yeah, number of applicants you accept into your cohort.
Yep, so it will vary whether you're a grad certificate applicant versus a traditional BSN to DNP applicant. With the COVID numbers, if you are a BSN to DNP applicant, you would be starting your core courses in the fall, the following fall when you would admit, and you wouldn't actually be doing your clinicals for about 3 to 4 years. If you are a graduate certificate student, that would change a little bit. But the numbers that we typically take from the acute care program, our cohorts are about 15 in size right now. Usually a portion of those is from the Rochester area associated with the Mayo Clinic, and then we do have another portion from the Twin Cities, even as far north of northern Minnesota as I'm drawing a blank on the city that my student is from right now up there, Crosby, Minnesota, excuse me, the North Dakota border, and then Iowa and Wisconsin as well. So we get an array of applicants, but right now our cohorts are about 15.
Thank you.
Dr. Veland, do you want to talk about the FNP program?
Sure. So for the FNP program, we are growing our program a lot due to Dr. Borman's work in working on clinical sites. So we are aiming to have a cohort of 24. So we're kind of just gradually increasing that. And again, I think that I don't know that COVID will really impact applications, other than perhaps that maybe people will wait due to the uncertainty of their jobs or of how things are going. We are still waiting for some of our students who are ready to start clinical this fall, waiting to hear back if places are going to open back up. But like for example, one of our large institutions has already started taking students back. So we're hopeful.
And then Amy Harder, do you want to respond for the Psych program?
Yeah, I would echo what Mika and Kim had mentioned is, it depends on our clinical sites. We have a lot of partners that we have in the cities and, southern Wisconsin, and then also northern Minnesota for psych and mental health NPs. And so, we admit as long as we have a placement available, and our program is growing, and we have been up to, I believe, 9. We're in our 4th cohort at this point. And so it's really exciting each year. It seems to be growing more and more. And each year we're developing in more clinical partners. And so, you know, I anticipate that we will continue to grow and continue to have sites available, and hopefully someday be up to that 24 like Dr. Valen.
Thank you. Were there any other questions from students? I know that I saw in the chat somebody had a question about applications being due, and the due date is October 1st, and that would be for start of fall 2021. Were there any other questions? Let's see, there's a couple questions in the chat function. Acute care NP program, can you please further discuss the need to physically be in class versus online?
Yep. So for the acute care NP program, for the first, if you're a traditional student, can I ask Carol, are you a traditional student or a graduate certificate?
I'd be traditional.
Traditional, okay, thank you. For the traditional student, so the first 2 to 3 years of the program are those core courses, your pathophysiology, physical exam or physical assessment, health promotion, evidence-based practice, and nursing theory. Those are typically on camp or face-to-face or hybrid, if you will. 1 day a week, it's usually on Wednesdays. So it'd be usually I'd say 1 to 2 days a week you need to be available, but we have a lot of hybrid options available, so you wouldn't necessarily need to come to campus, but could log on via Zoom or via a hybrid option. For the acute care program, that clinical or focus year that you have, we front load our didactic. So there's about 2 weeks of didactic at the first 2 weeks of each semester in that last or final year of your program, whether you're the 3 or 4 year program. And that's when you would do your 2 weeks of didactic up front. And then we meet about 2 days a month, usually on Mondays throughout the semester, to come together as a group for a simulation, clinical seminar, and the like. So again, usually for further on in the program, it's about the first 2 weeks of each semester, but during the core courses, those first couple of years of the program, those are going to be usually at least 1 day a week, hybrid or on Zoom, or if it's hybrid, it'd be 4 times a month, give or take which semester you take those specific classes.
Perfect, thank you.
Thanks, Dr. Langer. Dr. Valen, I'm gonna ask you to respond to 2 questions. Oh, she already typed it. So the first one was about time on campus for the FNP program. And then I was hoping that you would also then just expand a little bit further. There was a question about the timeline for application. So after the student applies by the October 1st timeline, what happens after that with the interview, notifications, etc.?
That's an excellent question. Every application is reviewed by at least 2 faculty members. And so I really want to stress what was said earlier in this presentation about really making your application as strong as it can be. If you have some experience perhaps in your community service or in institutional service and you're not quite sure if it counts or not, put it down. Tell us what you did during that. How did you grow from that experience? You know, it's better to put it down and we say, okay, that doesn't add you any points, than to not put it in there, because a lot of that stuff does count. We really want to see how your life experiences have shaped you and how they're going to make you a better NP. So first of all, those applications are gone through by at least 2 faculty members, and then we decide from that how many students we are able to interview. We do try to have those application decisions made by December, but it does take a while, unfortunately, just to get through all of them, and we want to be sure that we, you know, give every application the time it deserves.
I have another question for Dr. Langer. The question is, one of the AGAC NP admission requirement is 1 year experience in ICU or ED. What are the chances for an applicant who does not have the experience in those settings?
So this is a preferred requirement, that's not required. So we've had many students come through our program who have not worked in the ICU, but have worked on a medical floor that is essentially like an ICU, but your patients are much more clinically complex. So those working in hematology, oncology floors, transplant, cardiology, even hospital medicine, that's a complex care unit. I've had students from many different backgrounds. So I would say about half, maybe 2/3 of my students are actually ICU nurses who come through the program. The other portion are students who have worked on medical floors of clinically complex patients from that perspective. So I don't want to say that if you don't have a year of ICU or ED experience, but you have other clinical experiences or professional experiences that more or less support kind of a similar aspect, we do take that into consideration.
Thank you. I see there's one more question about the Psych program and if working in Psych would help the applicant be considered for the program.
This is Dr. Langer. I'll say that any experiences you have, as Dr. Valen said, to put those in your application because they can only help you, not necessarily harm you, and it gives us a chance to know who you are and to help us see the well-roundedness of your background, your nursing background. So I hate to say that, you know, saying somebody works in a certain unit would help them be considered for a program, because I'd like to say we consider all of our applicants based on our criteria, the experiences they have to show to us in terms of what they hope to bring to their new role as a nurse practitioner. So I would say it can only help you. It really can't harm you.
Thank you so much. It doesn't look like there's any additional questions. Thank you so much for joining us for this Lunch and Learn virtual open house to learn about WSU's NP programs. You see on there key contact information. Please reach out to us if you have any additional questions, or if you want to be connected to a specific program coordinator. You know, we can help facilitate that too. So thank you, everyone. Have a wonderful rest of your week. Stay well and be safe.